Good afternoon, everybody. My name is Javier, and I am the CEO and co-founder here at IOMED. And I want everyone in the room to travel with me 50 years back in time. Okay, try to think about a company in any sector, 50 years back in time. Now try to think how that company managed its information 50 years ago. Try to think of all those piles of paper on top of the desks. Now try to think how difficult it was for those companies back then to perform any kind of analysis. How complicated it was to do something as simple as a sales chart. But I'm making you do this trip back in time because in healthcare, we're at that point today. 85% of the information we store in medical records about patients is stored in this format, which is pretty much the same as saving piles of paper in a digital way. Saving this information this way actually transforms this information into non-reusable medical data. Data we cannot treat, we cannot aggregate, we cannot pretty much use in any other way besides reading through them. And that is a huge problem. Or better said, that is a huge opportunity. Because according to McKinsey Global Institute, we can save up to $300 billion only in the United States by applying data analytic techniques on those data contained in medical records. And that's actually the opportunity driving us at IOMED. At IOMED, we have created a solution that mainly consists of three main technological pillars: data extraction, data storage, and the generation of data predictive analytics. Basically, a solution that generates value-added predictions on top of unstructured electronic health record texts. I bring you this as an example for you. For a real case, we had to go through 2 million texts like the one you're seeing on the screen. After performing with our algorithms on that, we extracted a database of more than 200 million data points like this one you're seeing. And on that, we could start generating analysis and predictions. And it's exactly this analytic capabilities the one we are selling. We're selling it to intermediary companies that are then implementing our technology in hospitals within their portfolio of clients. Those intermediary companies can be segmented into integrators, consulting firms, and insurance companies. And this is a business model we want to start performing in Spain and Latin America and scale worldwide to a global market of over 2 billion euros a year. And to make this a reality, I actually bring you the best I have today, which is our team. Our team is composed by a medical doctor, Javier, a biotechnologist, Alvaro, and myself in the business administration department. As you can see, we're a very balanced team, young team, committed team, but also a very well-supported team, as we count on the support of very important and experienced advisors in several areas that are helping us in our daily activities. Thanks to the collaboration of this team, we have achieved important milestones like the one with Hospital Vall d'Hebron. Actually, our solution is nowadays working actively in this hospital and has performed already and analyzed already over 17 million medical records. Also, we are expanding to a new hospital very soon. We are already signing a contract with #1 vendor of electronic health record in the world, and we're also signing a contract with the leader for hospital information systems in Spain. Also in the financial area, we have achieved several important milestones with the first fundraising, public funds, and the investment of the fund Pioneers. All of these first steps of a very ambitious business plan that has to bring us to revenues of around 5 million euros in the year 2020. And to get there, of course, the first step is to close the current fundraising round, which is €500,000, and for which we have already closed around 70% of the sale. At this point, I would like to finish my presentation by inviting you to join us, to join this wonderful team, and to actually join us in this challenge of bringing intelligence to medical data. Thank you so much. Now I'm sitting down for your questions.
You have gone really quickly over that, but can you tell us a little more about what technologies are behind this project?
So, probably this slide helps. Basically, so we have a first layer of natural language processing, which is basically an algorithm capable of reading through human written texts. Through those natural language processing technology, we can then extract all the data that our algorithms understand as clinically relevant, which includes diagnostics, procedures, but also symptoms, findings, let's say anatomic parts, time concepts, and so on. So we extract all those data and then move on to the second technology layer, which is a multimodal database, which has been created especially for the management of clinical data, incorporating knowledge from medical ontologies and other sources. And we finally go to the part of the predictive analytics, where we apply several models in order to, based on the history of the medical records we have already structured and analyzed, being able to actually generate a prediction and validate that prediction using this history.
In the technology that you are using, is a repository or the kind of database, like a graph database, important for retrieving the information very quickly?
We are using a graph-based database. It's part of this multimodal database I just mentioned. And those graphs, basically what we are using, let's say, for the graphs, is the relationships that we find within the medical ontologies. In the medical ontologies, we find not only the concepts of medicine, but also the correlations between these concepts. These correlations, we are incorporating them into our graphs, and therefore using them for much quicker exploring and querying our database.
How do you know that what your system puts out is relevant, good, correct, the best answer, whatever? How do you know that?
So in our first extraction, in that data extraction, we have incorporated, let's say, a learning model that is helped not only by technology, but there is also a human review of the parts that where we find that the findings are either not being found in our previous vocabulary, or either new or confusing for the systems. And these reviews are done by professionals that are independent, so they are outside our company, but they are partnering with us. And through their reviews, we're incorporating those corrections into the system for further analytics in the future. So we're actually having it tested by professionals.
Yeah, another question about the technology. Does the system get better with its use? I mean, and this getting better can be transplanted to other medical centers, and how difficult it is to do that in other languages? I mean, how limiting is the language for you to grow in the future?
Sure. So the first question, the system does get better with use. When we implement our system in a hospital, of course we cannot retrieve the data from the hospital outside, because it's of course not permitted according to the legislation. But we work on the data within the hospital. The knowledge we get in there, these corrections I was mentioning before, these can be exported from one hospital to another very easily, without any problem. The second question, jumping from one language to another is, of course, a challenge. But we expect it to be overcome not in this coming period in the midterm, but longer in the long term. We're planning to jump into English and French as well.
Thank you for that. I think it's really interesting technology, and one of the questions I had was similar about the sort of AI versus human interaction and how the validity of the predictive analytics were being vetted. So you mentioned that for outliers or kind of things that the reader presented as funny were being reviewed, but are the sort of common things also being reviewed to make sure that the predictions are consistent?
Sure. Let's say those concepts that are not being highlighted as confusing or not appearing in the vocabulary are automatically also being tested against the basis of what we actually took as knowledge bases, which is the medical ontologies and research papers in general. So this connection actually makes the concept we extract and are not, let's say, highlighted as confusing. They will be already constantly checked against this, let's say, knowledge basis. So this part, which is the most part of what we extract, is actually guaranteed quality in that sense.
And one other question in terms of the learning sets that are being fed into the model. Do you expect to see any differences geographically in terms of guidelines and genomics or any genetics or anything sort of that's specific to, say, the Spanish clinical practice versus another one?
Yeah. Even within the Spanish clinical practice, we will see differences between geographic areas. We will see different results for a predictive model in Catalonia, which has probably a Mediterranean climate, versus Galicia, which is way more rainy, cold, and terrible weather, as you know. So we expect to see differences in that, but this is not this rather than being a challenge is actually a good thing for us, because it enables our algorithms to increase their knowledge in these fields and adapt to different realities. So as I was answering to the Greece before, if we get a reality, for example, in Galicia, let's say, we get a certain mobility for palliative treatments, and we generate a prediction in that sense, we can incorporate this knowledge to a hospital by the Rhone, for example, here in Barcelona, which probably will have different results, although they may have similarities. We can combine this knowledge without combining the data, which is very important. We can combine this knowledge and then make our algorithm stronger in that sense.
So the knowledge learned.
So the knowledge.
We will have time anyway.
In each hospital is being transferred throughout
The knowledge, but never the
knowledge
data.
throughout
Yeah.
the data.
All right, thank you so much.
Sorry.